The stock tray is selected to be slightly wider than the patient's arch. Use a print of a wax wafer to determine how wide this should be and match it up against the most appropriate size tray. Confirm that the selected tray is the right size for the patient's arch. There should be a little bit of room for sideways movement. Repeat this procedure for the opposing arch. If using silicone putty to adapt the tray, apply the appropriate adhesive. Mix the silicone putty to an even colour and adapt it to the tray in the areas that need extending. Mould the unset putty in the mouth. Massage the lips and cheeks to form the buccal sulci. And in the lower jaw, ask the patient to protrude the tongue to mould the lingual sulcus. Remove the tray from the mouth when the putty has set and inspect it for areas of excess. Excess material can be removed with a scalpel. Wax strips can be used to adapt the tray. Heat the wax in a safe air heater, and when it softens, adapt it to the tray and fold it over to form an extension wall. Rewarm the wax just before inserting the tray in the mouth. Adapt the tray with the softened wax in the mouth by tissue moulding. Use a smooth massaging action to create the shape of the sulci. Inspect the wax for areas of overextension and trim back accordingly, particularly over the areas of the buccal or labial freni. Repeat this procedure for the other side of the tray. Extend the posterior border of the tray with a strip of wax. This can be formed into a lip, which helps to prevent the escape of material from the back of the impression. Check that the tray is fully extended before making the impression. Apply a thin layer of adhesive to the tray. Pay attention to ensure that the edges of the tray are thinly covered. Repeat this procedure for the lower tray. Be sure to use the correct adhesive for alginate. Shake the alginate well before mixing. Dispense the correct amount of alginate using the spoon provided. Form a well in the middle of the alginate. Add the appropriate amount of water according to the number of scoops of powder used. Incorporate the water into the powder and then mix vigorously into a smooth, creamy paste, paying attention to remove as much air as possible from the mix. Load the tray with the alginate, being careful not to overfill the tray, as this may make it difficult to seat in the mouth. Wipe some alginate on the teeth to be recorded before inserting the tray into the mouth. Once seated, excess alginate should flow out the side, and this can be moulded using a massaging action. In the lower jaw, ask the patient to protrude the tongue to mould the lingual sulcus. Support the tray, and when the material has set, remove the impression from the mouth. Inspect the impression to ensure that all the necessary detail is recorded. Small errors such as air blows may be corrected by filling in with wax, but large errors will mean the impression needs to be done again. Repeat these stages for the upper jaw. Inspect the upper impression to ensure that all the relevant surface detail is recorded. Wipe excess alginate material from the patient's face using a damp tissue. Place the impressions in disinfectant for 10 minutes and remove. Wrap the disinfected impressions in damp gauze and seal in a plastic bag before sending to the laboratory. Don't forget to fill in a lab card for the work that you need to have done.